Hello, I'm Dr. Ehtisham Mahmud, an interventional cardiologist at UC San Diego Health, and I specialize in CTEPH.
Hello, I am Dr. Nick Kim, a pulmonologist at UC San Diego Health. I specialize in CTEPH treatment.
In this video, we will answer questions that you may have about PTE surgery versus BPA.
What does PTE stand for? PTE stands for pulmonary thromboendarterectomy, which is a specialized surgery, sometimes referred to also as pulmonary endarterectomy. What is pulmonary endarterectomy surgery? Pulmonary endarterectomy surgery, or PTE surgery, is a treatment of choice for patients suffering from chronic thromboembolic pulmonary hypertension. It's a highly specialized surgery to remove the chronic scar tissue from prior blood clots in the lungs.
What does BPA stand for? BPA stands for balloon pulmonary angioplasty.
BPA is treatment for patients with chronic thromboembolic pulmonary hypertension who are not eligible for pulmonary endarterectomy surgery. Unlike endarterectomy surgery, this is not an open heart surgery. It's done through catheters. We insert various catheters and wires into areas of vessel narrowing and then use balloons, series of balloons, to try to open those vessels to alleviate some of the pulmonary hypertension.
What are the main differences between BPA and PTE surgery? Even though both BPA and PTE treat the same disease, balloon pulmonary angioplasty is a relatively short procedure that's done as an outpatient. It requires multiple procedures over a few weeks or sometimes a few months. What makes someone a good candidate for BPA versus PTE surgery? People who have multiple medical problems can sometimes not be good candidates for a long 9 to 10 hour PTE surgery. Those patients with CTEPH who have multiple other medical problems can be better treated with BPA. BPA is done as an outpatient without general anesthesia. Also, if the blood clots affecting your lung arteries are in smaller blood vessels that are more distal, they're easier treated with a balloon procedure than with surgery.
Can a patient receive both treatments, and in what situations? Absolutely. PTE surgery and BPA are not mutually exclusive. They can be complementary. For example, if you have CTEPH and you undergo PTE surgery, you can get some dramatic improvement in your condition. However, in some patients, you may have some residual pulmonary hypertension and some residual symptoms. And in those patients, BPA may be the next best treatment option.
What should patients know about the recovery and risks of each option? The recovery for BPA procedures is relatively quick. Patients stay one night in the hospital for observation and then they go home. However, most patients require 4 to 6 BPA treatment sessions. The recovery for PTE surgery is more extensive. You're in the hospital for well over a week, and the recovery afterwards also takes a few weeks.